So the first step of placing lifting threads is to map out exactly where we want to place the threads. We then inject a little bit of lidocaine into the injection site. We then place our pilot needle, and through that one small poke, we're able to insert a blunt tip cannula and lay threads of lidocaine numbing solution along the tracks of where we plan to place the threads. This helps to make the procedure very comfortable, and you just feel a little bit of pressure and a little bit of stinging as the lidocaine goes in. After that, the tracks where we place the polydidactone threads are pretty numb and the procedure gets a bit more comfortable. So you see us now doing the same thing on the other side, placing that pilot hole needle, advancing with the cannula, and placing some lidocaine along the track. The next step is to place the pilot hole through which I'll place the thread. So now you see me advancing a cannula. Inside that cannula has a lifting thread. So as I pull the cannula out, the thread stays in place. The thread has little frays on it that catch the tissue. So when we pull back on the thread, the tissue catches and you get a lifting effect. We may place multiple threads through a single pilot hole for certain areas. So you see me placing the second thread, working with the tissue to help it catch on the frays of the thread and then pulling back. So same thing on the other side. You see me placing the sterile hypodermic cannula, which is preloaded with an absorbable PDO suture thread, which helps to absorb and build your own natural collagen to the area. So I place the two lifting threads again through the same pilot hole on this side, pull the cannula out, and leave the suture or the thread in place. These polydidactone threads are dissolvable suture threads that have been used for decades in surgical procedures. More recently, they have been introduced to provide lift to sagging skin to the midface, jowls, and neck. So treatments that we can do is to soften scars, we can treat necklace lines, and stimulate skin tightening on the face and in the neck. Benefits of PDO threads is that the threads reabsorb in about 6 to 9 months after placement. Once they reabsorb, they leave collagen and elastin in their place, and because of that, the results can last about 12 to 18 months or even longer. There's a much lower risk of complication compared to a facelift surgical procedure. Like I said before, they build the collagen and elastin and also stimulate hyaluronic acid production. They're non-migratory and non-carcinogenic with minimal downtime as well. Thread lift pre-treatment instructions. To minimize bruising, avoid taking blood thinners for 3 days prior to your treatment. This includes baby aspirin, Aleve, Motrin, vitamin E, and fish oils, as they can cause you to bruise more easily. If you are prescribed any blood thinners by a doctor, please consult with your physician before discontinuing any medication. Please do not drink alcohol for 3 days prior to the procedure. Please do not schedule any dental work, including cleanings, 2 weeks prior to your treatment. Always inform your injector of all medications you may be taking, as well as any changes in your medical history. Here you see me placing smooth threads. These are different from the lifting threads we just discussed because they are lacking the frays. They don't pull up on any of the tissue, they just stay exactly where they are placed. They dissolve after about 3 to 4 months, and when they dissolve, they leave in their place collagen and elastin, therefore tightening and strengthening the skin. We can use smooth threads to treat crepey, loose skin, acne scars, fine lines, and deep lines as well. We recommend 1 to 3 treatments about a month apart, and then results show up about 3 to 4 months later once the threads completely dissolve.